Class, hello and welcome to this Advanced Practice in Health and Social Care session on the quality of life. I will be your tutor, Big Owl. Today, we are going to look at what is meant by quality of life, psychological factors, nutrition and exercise, physical safety and hygiene. Let's first look at what quality of life means. People perceive many different things when they think about the quality of life. People will have different ideas and value systems in helping them to determine which factors they think are important when looking at their quality of life. This can also vary between people of different ages, gender, social status, and cultural beliefs. A person's quality of life can depend on their physical surroundings and psychological well-being. For example, quality of life may be affected by not having adequate housing and enough food, but will also include their emotional state and personal life. Factors such as having a good network of friends and family may make a person feel safe and supported, thereby enhancing their psychological well-being. Therefore, quality of life may depend on a number of factors that can be identified into two main groups: psychological factors and physical factors. What are psychological factors? There are a number of different factors that can impact on a person's psychological well-being. When we look at a person's psychological well-being, we are looking at what influences the way they are feeling. For example, these influences can be social, environmental, or economical. As we grow and develop, moving from childhood to adulthood, this can be seen as an important time in developing our own self-esteem and confidence. Below is a list of factors that can impact on a person's psychological well-being: occupation, stimulation, effective communication, choice, autonomy, equitable treatment, social contact, social support, approval, privacy, dignity, confidentiality, psychological security. Occupation. Training for work is now a prominent feature in industrialized societies. In the UK, there are numerous agencies and services available to support people to gain employment. There is also an increase in vocational training being offered by colleges and apprenticeships. Quality of employment can vary from positive and pleasure to negative experiences, which can impact on psychological well-being in different ways. For example, low pay, poor working conditions, and job satisfaction can lead to an individual to feel demotivated to work, low self-esteem, and overall have a negative impact on their well-being. In contrast, a job with good prospects where there is opportunity for training to further skills and promotion, this may motivate an individual to work hard, where this would be recognized and rewarded through pay increase or promotion, which can have a positive effect on their well-being. Quality of living also reflects the interaction of political, socio-economic, and environmental. Jahoda, 1987, suggested that being in employment provided 5 categories of psychological experience which are conducive to well-being. Jahoda believed that being unemployed deprived you of these experiences and in turn would contribute to a decrease in a person's well-being. These experiences are time structure, social contact, collective effort of purpose, social identity or status, regular activity. More current research suggests that the unemployed can gain access to the 5 categories suggested by Jahoda, and that those with better access have better well-being. Access can come from work-like activities, leisure, and general social interaction. It is important to remember that how people can define quality of life will vary from one individual to another. Recent psychological research has shown there is not necessarily positive links to wealth and happiness. Diener in 2000 and Myers in 2002 suggest that people are happier if they live in wealthy rather than poor nations. However, once individuals have enough money to pay for their basic needs of food, shelter, and so on, money does relatively little to improve happiness. That further increases in personal income do not tend to have much effect on changes in the personal happiness of citizens. There are other factors in the wider community that can affect a person's quality of life, such as socio-economic, political, and environmental. Socio-economic conditions can be, for example, the impact of recession on people's jobs. This can lead people to feel uncertain if their job is secure. Socio-economic factors can also include the level of education needed to obtain a job, consumer needs, poverty, and social exclusion. War and political unrest may cause the infrastructure of a country to be unstable. This can impact on people's lives. For example, people may need to evacuate their own country and look for refuge in other areas or different countries for their own safety. Environmental factors include the spread of infectious diseases, poor sewage systems and poor availability of water, lack of resources within a community, and poor medical care due to the conflict caused by war. Many of these factors are interlinked and will therefore impact on each other depending on the event. What about food? Surely if a person has a poor diet, this will affect their quality of life, because it can affect their health, their emotional well-being and so on? Yes, that's a good point. Good nutrition is important for everyone. Depending on people's circumstances, they may need to focus more on their diet at different stages of their life. Healthy and nutritious diets are important in the growth and development of children. A balanced diet from a young age not only helps in children's physical development, but also intellectually to help them to do well in their education. Through all stages of life, a healthy diet can benefit everybody. For example, during pregnancy, women may take in additional vitamins and minerals such as folic acid to ensure that the right nutrients are passed on to the baby and help with their growth and development. Another example is in old age. Elderly people must be careful with their diet to prevent problems such as osteoporosis. This is a major health issue for older people, particularly women. This is where bone density reduces and so increases the risk of fractures. Older people may increase their calcium intake, such as eating more dairy products like milk, cheese, and yogurts as a preventative measure. Good sources of calcium are dairy products such as milk, cheese, and yogurt. Other sources of calcium include green leafy vegetables such as broccoli. What people eat can also help reduce the risk for chronic diseases such as heart disease, strokes, high blood pressure, and high blood cholesterol. A healthy diet can also provide people with more energy and also boost people's self-confidence. How important is exercise? I read an article that said exercise can help improve your mood. Is this true? Yes, exercise has been found to have many benefits. We need to care and maintain our bodies not just by a balanced diet, but also by doing exercise. Exercise can include walking, running, housework, and anything that increases the heart rate. If people do not do any exercise and eat more calories than the body needs, this can sometimes lead to people putting on weight, and in some cases, individuals can become obese. This can cause health problems such as heart disease, high blood pressure, or diabetes. Being underweight can also affect your health. For women, for example, who are very underweight, can impact on their fertility and menstrual cycle. One reason being is that they lack the necessary nutrients to ensure that their body is able to function appropriately. People who are dangerously underweight may become anorexic. People who suffer from anorexia place themselves in high risk of fractures and developing osteoporosis. Benefits of exercise can include reduction of stress, weight balance, reduced risk of chronic diseases, increase in self-esteem and confidence, improvement of cardiovascular function. What effects can the environment in which we live have? It is important that people feel safe in their surroundings, such as their own home, where they can complete daily living tasks in a clean and secure environment. The condition of the home can impact on a person's safety and well-being. For example, children under the age of 2 and younger are not able to understand and recognize many dangers that threaten their physical safety. Parents must take measures to keep babies and young children safe from everyday hazards both inside and outside of the home. If an individual's home is very dirty and messy, this could be hazardous if there are lots of items left lying around, as the person or child could trip or fall. If there is a lot of litter and rotten food left to decay in a home, this could cause the person to develop health problems and could attract mice and rats, which may lead to an infestation. Associated with ensuring good health and cleanliness is hygiene. Good hygiene can be seen as a preventative measure, reducing the risk of developing illness and maintaining good health. For example, using a service such as hospital, there are standards to be maintained to ensure that everyone's health is not put at risk, such as cleaning your hands when you enter and leave a hospital. Another example of good hygiene is with the preparation of food. It is important that food is prepared and cooked properly. If basic food practices are not met, this could put people at risk of illness such as food poisoning. It is important for a person to feel physically comfortable in their surroundings and environment, that they feel safe and secure. A person may feel physical discomfort, for example, if they are too hot or too cold, or if their environment is too noisy. These factors could impact on a person's social and emotional well-being, as well as their physical. Physical discomfort may be caused from feeling pain or ill health, such as from a skin irritation or cold, which impacts on a person's ability to focus on work or sleep. Material causes of ill health, such as living conditions, working conditions, housing, transport, environmental hazards and stress, can also impact on a person's ability to feel physically comfortable in their own environment. These factors are often seen from occurring with an individual's social structure and environment. For example, the condition of an individual's home could make a person feel physical discomfort if there was no heating and they felt constantly cold. Physical comfort is particularly important in health and social care settings for clients who are unable to control their own environment. Care workers should try to ensure that the clients they are caring for are able to be physically comfortable. In order to achieve this, the care worker may try to minimize any discomfort. This could be ensuring they are able to rest in their beds comfortably, making sure they have enough pillows, using pressure-reducing aids, adjusting lighting, that the home is adequately warm, and that the client is able to access drinks and snacks easily. To summarize what we have learned today, we have looked at what is meant by quality of life, psychological factors which affect quality of life, the importance of diet and nutrition, how our living environment affects quality of life. Goodbye, class, and good luck.